a new mom or soon to be filled with 1,000 doubts about breastfeeding? Are you wondering if your milk is enough, why your baby is feeding so often, whether that pain is normal, or if you can continue feeding when you're tired, sick, or even pregnant? I see you, I hear you. You're not alone. So many moms carry these questions in their heart, but they don't always get the answers they deserve. That's why in this video, I'm going to walk you through the 20 of the most common and important breastfeeding questions that new moms ask. But not just as dry facts. I'll explain each question with love, real world clarity, and science so that by the end of this video, you'll feel reassured, informed, and more confident in your feeding journey. How do I know if my baby is getting enough milk? This is the number one question almost every breastfeeding mothers ask, and for good reason. Unlike bottle feeding, whether you can see exactly how much milk your baby drinks, breastfeeding can feel like a mystery. You feed, but you can't see how much went in. So, how do you know? Look at your baby, not the measuring cup. Your baby will tell you. If your baby is feeding at least 8 to 12 times in 24 hours, seems satisfied after feeds, and sleeps peacefully between most feeds, that's a good sign. After the first 5 days, your baby should have at least 6 heavy wet nappies per day and soft yellow stools. These are your clues. Weight gain is the ultimate confirmation. Yes, babies do lose a little weight in the first few days. That's normal. But by day 10 to 14, most babies should regain their birth weight and continue to grow steadily. You may not see the milk, but your baby's growth, output, and calmness after feeding are proof that your baby is doing its job beautifully. Can breastfeeding hurt? Let me say this clearly. Breastfeeding should not be painful. A little sensitivity in the first week, yes, that's normal. Your nipples are adjusting to a new rhythm of sucking and stimulation. But if you're feeling sharp pain every time baby latches, if your nipples are cracking, bleeding, or making you dread feeding time, that's a red flag. Pain usually means that something about the latch needs to be corrected. Often, baby is not latched deeply enough and is sucking only on the nipple instead of taking a large part of the areola into the mouth. A proper latch should feel like a strong rhythmic tug, not a pinch or sting. If you feel pain every time, try changing your position. Make sure your baby's chin is touching your breast, nose tilted up, and mouth wide open like a yawn. Your nipple should go deep into the baby's mouth. If pain continues, don't wait and suffer. Reach out to a lactation consultant. Even one session can save your entire journey. You don't have to suffer through breastfeeding. You deserve comfort and joy too. Why is my baby feeding so frequently? You might feel like your baby is glued to your breast, feeding every hour, every 30 minutes, and you wonder, is something wrong? Do I not have enough milk? Let me assure you, this is very normal. In the first 6 to 8 weeks, especially babies feed often, sometimes 10 to 15 times a day or more. This is called cluster feeding. It helps build your milk supply and also comforts your baby. Remember, babies nurse not just for hunger, they nurse for warmth, for sleep, for connection, and to feel safe. Breastfeeding is not just food, it's a relationship. And yes, this frequent feeding can feel overwhelming, especially when you're exhausted. But it doesn't mean your milk is low. It means your baby is doing their job, asking your body to make exactly what they need. If baby's peeing, pooping, and gaining weight, everything is on track. My baby feeds only for 5 minutes. Is that okay? Some babies are what we call efficient feeders. They latch well, drink well, and get what they need in 5 to 10 minutes. Others nurse for 30 to 40 minutes. Both can be normal. If your baby is feeding short but seems satisfied, is gaining weight, and has good output, then don't worry. They are simply fast eaters. Let your baby decide the length of the feed. Don't try to control the clock. Look at them. They know better than the timer. My baby falls asleep while feeding. Should I worry? Newborns are tiny, sleepy beings. Feeding is hard work for them. It's warm, soothing, and often puts them right to sleep. It's very common for babies to doze off at the breast. But if they're falling asleep within a minute or two every time and you're not hearing active swallowing, You may need to gently stimulate them. Try tickling their feet, rubbing their back, or switching breasts. Skin to skin can help too. Make sure the room isn't too warm. That said, some babies take what they need in just a few minutes and nap peacefully. If they are gaining weight and feeding frequently overall, don't worry. Breasts feel soft. Is my milk drying up? Not at all. In the early days, breasts may feel full, heavy, or even engorged. That's your body learning to produce milk. But around 6 to 8 weeks, your milk production regulates. Your breast may feel softer, less leaky, and not as full as before. But that's a good sign. It means your supply is now perfectly matched to your baby's needs. Milk is still being made, just more on demand. You're not losing supply, you're becoming efficient. Can I express milk and feed in a bottle? I understand the need, but bottles are not recommended, especially in the early months. Why? Because bottles flow fast, without effort. If introduced too early, babies may prefer that flow and start refusing the breast. This is called nipple confusion or flow preference. If you need to feed expressed milk, use safer alternatives like Paladay, spoon, small medicine cup, or a nifty cup. These options allow your baby to sip, not suck, which protects breastfeeding and encourages normal development. If pumping, try hand expression in the early days. It's gentle, effective, and doesn't overstimulate. You have options. You're not limited to bottles. And every feed counts. Can I breastfeed if I'm sick? Yes, in most cases. Not only is it safe to breastfeed when you're sick, it's actually protective. When your body fights an illness, it produces antibodies. These antibodies pass into your milk and helps protect your baby from the infection. Whether it's a cold, mild fever, stomach bug, you can continue feeding. Wash your hands well, wear a mask if needed, and rest. The only time to pause is if you have a serious illness or your doctor advises stopping temporarily, but that's rare. Why does my baby spit up so much? Spitting up is normal in young babies. Their digestive system is still immature, and the valve at the top of the stomach may be loose. Milk can come back up, especially if they are moved quickly after feeding. If your baby is gaining weight, is happy, and the spit up is mild, it's not a problem. Try feeding in a more upright position. Keep baby upright 20 minutes after feeding. Burp gently during and after feeds. Only worry if your baby is vomiting forcefully, losing weight, or has a green or yellow spit. In that case, consult your doctor. How long should I breastfeed? That's your decision. WHO recommends exclusive breastfeeding for the first 6 months and continue breastfeeding along with solids for 2 years or beyond. Breast milk doesn't suddenly lose value after 6 months or 1 year. It continues to provide nutrition, immunity, and comfort. Whether you stop at 12 months or 2 years, choose what works for you and your baby. There is no deadline, no pressure, just your rhythm. Why is my baby pulling off the breast and crying? This can feel confusing and even frustrating. You're doing everything right, and yet your baby latches, sucks for a few seconds, and suddenly pulls off crying. What's going on? First, remember babies communicate through their body. Crying, pulling, arching, these are always of saying something doesn't feel right. There are few reasons this might happen. Sometimes you're let down, the reflex that releases milk might be too fast. Baby feels overwhelmed by the sudden gush of milk and pulls away to catch their breath. In that case, try leaning back during feeding. Gravity slows the flow or allow the first letdown to pass into a clot, then relatch baby. Other times, your letdown might be too slow. Baby becomes impatient, expecting milk immediately. Skin to skin, gentle massage, or switching breast can help. Or maybe baby has trapped gas or reflux, and pulling off helps them relieve pressure. Try burping them halfway through or feeding in an upright position. Don't take it personally. Your baby isn't rejecting you, they're responding to their needs. Observe, stay calm, and adjust gently. You are learning each other. Can I eat traditional or spicy foods while breastfeeding? Yes, you can enjoy a regular food. You don't need to eat bland or special diets unless your baby shows a specific reaction. The flavors of your food actually pass subtly into your milk, which helps your baby develop taste preferences and accept solids later on. In fact, babies of mothers who eat a variety of foods while breastfeeding tend to be more open to diverse tastes when they start solids. That said, if you notice that a particular food seems to consistently upset your baby, like excess cabbage or cow's milk, try removing it for a while and observe. But don't fear your own culture's food. Eat your idli, chutney, rasam, kurma. Just make sure you're getting enough protein, iron, fats, and calories. And yes, drink more water. Trust your body, it's used to your food, and so is your baby. When will my periods return? Can I get pregnant while breastfeeding? This is an important and often misunderstood topic. For many breastfeeding moms, periods stay away for several months. That's because exclusive breastfeeding day and night can suppress ovulation. It's nature's way of giving your body time to heal before the next pregnancy. And this is key, it's not 100% reliable. You can ovulate before your first period, and yes, that means you can get pregnant without knowing. If you're not planning another pregnancy soon, speak to your doctor about safe contraceptive methods that don't affect your milk supply, like copper tea, condoms, or progestin only pills. And remember, whether your period returns in 2 months or 1 year, both are normal. Each mother's body is different. Can I take medicine while breastfeeding? Yes, most medicines are safe while breastfeeding. So many mothers stop feeding out of fear or are wrongly advised to pump and dump. The truth is, most common medications for fever, cold, infections, thyroid pass into your milk in very small amounts, often not harmful to your baby. The key is to check with a doctor who understands lactation or consult a lactation safe medicine databases like LactMed. Don't stop breastfeeding suddenly. If a medicine isn't safe, alternatives usually exist. Always ask, but don't assume. Your feeding relationship matters. Can I breastfeed during pregnancy? Yes, in most cases. You can continue breastfeeding safely during pregnancy, unless your doctor specifically advises you to stop due to a medical complication. There is no harm in continuing to nurse your older child. You may notice some changes like a nipple sensitivity, reduced milk supply, or changes in milk taste. Some toddlers may naturally wean while others continue happily. Your body is incredible. It knows how to nourish two children, one in your womb, one in your arms. How do I manage breastfeeding at night when I'm exhausted? Night feeds are exhausting, I know. You're waking multiple times, sitting up groggy eyed, wondering if you'll ever sleep again. But night nursing is normal, especially in the early months. Babies have small stomachs and fast digestion, and your milk making hormone prolactin is highest at night. To make it easier, try side lying position on a safe surface. This way, you and baby can rest while feeding. Co sleeping safely, following WHO and UNICEF guidelines, helps many mothers get more rest. Keep a water bottle nearby, a small snack, and a soft nightlight. You don't need to sit fully up for every feed. And remember, this phase will pass. Night waking doesn't last forever, though it feels like it. Can I pump and store milk? Yes, absolutely. Whether you're returning to work, need a break, or want someone else to help feed, expressing milk is a great option. You can hand express or use a pump. Once expressed, store milk using the 666 rule. 6 hours at room temperature if it's cool, 6 days in the fridge, 6 months in the freezer. Always label your container with date and time. Use clean, sterilized spoons or cups to feed expressed milk. Avoid bottles to protect your feeding rhythm. If you plan to return to work, start practicing expressing and storing 2 to 3 weeks in advance. My milk seems watery. Was it still good enough? Yes, your milk is perfect. Breast milk changes during the feed. The first milk, called foam milk, is more watery. It quenches thirst. The later milk, hint milk, is richer and fattier. If your baby is allowed to feed fully on one side before switching, they get both. Don't worry about how it looks. Even if it seems thin, it's packed with nutrients, enzymes, immune cells, and growth factors. Mother's milk isn't just food, it's medicine. Do I need to clean my breast before and after every feed? No, you don't. Your breasts are naturally clean. Overwashing or wiping with soap can dry out your skin and remove the protective oils your body makes to prevent infection. Just a gentle bath once a day is enough. No need to clean before every feed. In fact, your areola, the darker part around your nipple, secretes special oils and even smells that help baby find the breast and latch better. Nature knew what it was doing. Everyone says, I'm not producing enough. Should I give formula? This is such a painful comment to hear, especially when you're doing your best. Let me tell you this clearly. Most mothers are capable of producing enough milk with proper support, good latch, and feeding on demand. If your baby is growing well, has good pee and poop, and is happy most of the time, you don't need formula. Milk supply issues can usually be corrected, not replaced. Giving formula unnecessarily can reduce your supply. Surround yourself with people who believe in you, not those who rush to discourage you. If you're unsure, reach out. You don't have to decide alone. You have just heard 20 of the most common breastfeeding questions, and I hope they brought you not just information but comfort. This journey is not easy. It takes patience, support, and love, but you're capable. You're enough. And your milk, your body is a gift to your baby. If this video helped you, please like it, share it with another new mom, and subscribe for more gentle, supportive content in English, Tamil, and Malayalam. You're doing wonderfully. Keep going, Mama. I am here for you every step. See you in the next video. Thank you. Bye bye.